Hi, everyone. Thanks for your interest in Lifelong. I'm Eric Henley. I'm a family doc. I was the chief medical officer at Lifelong for 5.5 years. I retired last summer. Before I retired, for about the last 3 years, I worked very hard at developing a family medicine residency within Lifelong. And I want to tell you a little bit about why we did that and some of the things that we felt would benefit us and the community because of that. I stayed on at Lifelong as the institutional official overseeing the program and the program director and the core faculty, so I still have a connection to it. When we first conceived of doing this program about 3+ years ago, I had a background in medical education from being at the University of Illinois for 12 years. I was a faculty chair of the community and family medicine department, and I had a lot of belief that med ed was a really important piece of a program. Our reasoning for developing the program at Lifelong was really threefold. First, of course, we were really interested in workforce development, particularly family medicine physician development, and we hoped that the people who did their program residency with us would come and stay with us or work in the safety net, particularly in the East Bay and the Bay Area, in the urban area that we are in. I also felt like it would be a really good recruitment and retention tool for our providers, that a lot of them would be really excited about having a residency within Lifelong, especially the docs. A lot of them would want to work either as preceptors in the clinic or host residents doing rotations in other parts of Lifelong. And this has certainly turned out to be true. Finally, I think that developing a residency is a really community development thing for the community of Richmond, where our residency is located. Richmond is a very diverse community. It has a lot of socioeconomic challenges. Our building, the third floor of which is the teaching clinic, provides both a community development focus in the area as well as provides more health care for the people in Richmond and the surrounding areas. So I thought all three of these were really good reasons for us to develop a program. Also wanted to tell you a little bit about what kind of program we are. We are a teaching health center, which is different than most of the residency programs in the United States. Most residencies are hospital-based. The hospital holds the accreditation. The funding comes from Medicare to the hospital. In some sense, the hospital is the controlling agent. With a teaching health center, the community health center actually holds the accreditation. We don't get any funding from Medicare. However, we have other grants that have been awarded from the state of California and also from the federal government to support the teaching health center program. There are over 60 residencies across the country in primary care that are teaching health centers and over 750 residents. So Lifelong joins that company. And we know that a lot of students like yourselves are interested in learning and working with safety net populations, which is who we take care of. And that's really the reason teaching health centers were developed. Finally, I would just say that we at Lifelong have been very excited about beginning the residency. We were excited about recruiting the first class, and we've been very happy with the 6 residents who are our R1s now. I think it's been great for Lifelong as an organization. It's also been great for individual providers, physicians, and others who are in the organization. And I think you'll find the same thing when you come here. A lot of good energy and good spirit. Lifelong is an community health center that's pretty large and also has a really good reputation in the Bay Area and in California for the kind of organization it is. So I'm really happy that you're interested in our program. I hope you'll pursue possibility of coming here, and we look forward to any further interactions we have with you. Thanks very much for your time.